Let me ask you something that most men think about, but rarely ever say out loud. Have you ever wondered what actually happens to your body and your energy if you release every day? Because behind that short question, there is a mix of curiosity, shame, confusion, and sometimes relief that almost every man carries. I know that feeling in the room, the half smile, the lowered eyes, the urge to ask quietly. I am Dr. Nathan Hale, a board-certified urologist with 18 years in men's health and sexual medicine. And for a long time, I have sat across from men who want clear, practical answers without judgment. Today, I will give you a direct, evidence-based conversation about what daily release can do to your hormones, your brain, your prostate, and your day-to-day energy. And I will tell you how to test this safely for yourself. Before we go further, tell me where you are watching from in the comments. There is no single universal rule for every man. It depends on your age, your baseline hormones, your circulation, your reasons, and your recovery. And I will map the benefits, the real risks, and a simple 7-day experiment you can try. Stay with me because the first benefit will surprise you. I want to be clear about who I am and what this video will do for you. I spent the last decade balancing clinical care and research, collaborating with endocrinologists like Dr. Patel and rehabilitation specialists, and reviewing longitudinal studies from groups such as Harvard and the Society for Sexual Medicine. I work daily with men who face issues from low testosterone to prostate symptoms, and I translate science into steps you can actually use. In the next minutes, I will explain the physiology, what dopamine, prolactin, testosterone, and circulation do when you ejaculate frequently, then list 5 potential benefits and 5 possible downsides, provide practical checks to find your individual rhythm, and finish with a concrete 7-day plan and when to seek medical care. If you want practical, non-moralistic guidance rooted in data and clinical experience, you are in the right place. Let us briefly unpack the physiology in plain terms. Ejaculation is not just a mechanical event, it triggers neurochemical waves. Dopamine spikes with anticipation and arousal, giving a boost to motivation and focus, and then prolactin shows up afterwards to modulate satiety and recovery. Testosterone fluctuates across hours and days, but is more influenced by sleep, stress, and weight than by a single episode. Circulation matters because penile blood flow uses vascular elasticity similar to small vessel function elsewhere in the body. So regular activity that challenges and recovers those vessels can be neutral or beneficial for circulation. In some men, neurologically, repetition can change sensitivity. Frequent, intense stimulation without variability can blunt penile sensitivity for a period, while balanced stimulation with good recovery preserves sensitivity. Think of it like exercise and rest. The act is powerful. The body needs recovery, and hormones manage repair and mood. Age changes everything. A 38-year-old with robust sleep and hydration will respond differently than a 62-year-old with borderline testosterone and prostate enlargement. There are also psychiatric and behavioral pathways. Compulsive patterns activate reward circuits repeatedly, which can shift the balance between short-term pleasure and longer-term satisfaction. If this resonates, pause now and share in the comments. If you have ever thought about daily release, you are not alone. Many men carry curiosity and a bit of shame. Write where you are watching from and a short line about how you usually feel after. For example, Chicago, energized, or Madrid, tired and foggy. Your answers help others see they are not alone and help me choose future topics. Please write exactly that short format. City, how I feel, so others can scan quickly. Your contribution creates a small community that normalizes these conversations and helps shape the guidance I give. Thank you for that. Now, let us return to how the body actually responds after release and which signs tell you should rest versus continue. Now, the 5 potential benefits many men notice with examples and brief evidence. Benefit 1: short-term mood and stress relief. After release, you often get a drop in tension and an increase in calm because prolactin and oxytocin help close the arousal loop. Some studies link controlled sexual activity with improved mood and lower perceived stress. Imagine the soft exhale after climax, the warmth in your chest, the quieting of racing thoughts. That acute recovery can help you sleep and reset focus for the evening. Benefit 2. Improved sleep for some men. For those whose arousal ends with relaxation rather than stimulation, releasing before bed can help you fall asleep faster because of hormonal shifts and parasympathetic activation. Benefit 3. Maintenance of circulation and local vascular health. The rhythmic blood flow involved in erections and ejaculation can act like gentle vascular exercise for the pelvic area, supporting endothelial function when combined with walking and good cardiovascular habits. Benefit 4. Relief of prostate congestion in some cases, especially when prostatitis causes discomfort. Controlled ejaculation can reduce transient stagnant secretions and discomfort for certain men. Benefit 5. Reinforcement of intimacy and partner satisfaction when release is part of mutual sexual activity, improving relationship motivation and attachment hormones. For each benefit, I see patients like Michael who report less nighttime anxiety, or men like Carlos who say a post-sex sleep is deeper, and I cross-check those reports with sleep patterns and hormone panels where appropriate. Equally important are 5 real risks or downsides to consider. Risk 1. Temporary sensitivity reduction and blunted sexual pleasure if stimulation is frequent and always identical, which can erode long-term satisfaction and require longer recovery. You may notice less thrill or less erection quality for hours or days. Risk 2. Fatigue and lower energy the next day when release is used as frequent sleep aid or coping mechanism, particularly if it replaces restorative sleep habits, you may wake less refreshed. Risk 3. Mood dips for some men driven by rapid prolactin increases after orgasm that can transiently lower motivation. This is especially true in men with underlying depressive tendencies or low baseline testosterone. Risk 4. Behavioral compulsion. When the pattern shifts from optional to automatic, it can interfere with work and relationships. Compulsive sexual behavior involves reward circuitry and often needs behavioral strategies rather than medical fixes. Risk 5. Masking of an underlying medical problem. When release is used to relieve pelvic pain or discomfort, men sometimes delay evaluation of prostate issues, infections, or neurological causes. Examples include men who assumed all pelvic pain was fixed by ejaculation when they were actually developing prostatitis or bladder dysfunction. Listen to your body for pain, blood and semen, or sudden loss of function. Those are red flags. How do you find your rhythm practically? Start with a simple checklist each morning for 7 days. Did I wake restored or tired? How was my mood at noon? Did my erections feel sensitive or blunted? Did sex reduce or increase my overall energy? Did my sleep quality improve? These 5 simple markers let you track trends rather than fixate on a single episode. Concrete tips to support recovery. Prioritize sleep. Aim for consistent hydration across the day. Include brisk walks to improve circulation. Avoid heavy alcohol that disrupts testosterone and sleep, and vary stimulation to protect sensitivity. If you are training like an athlete, think of ejaculation as a training set. Dose, intensity, and rest matter. For example, Jamal, who is 42 and trains for triathlons, adjusted timing to avoid intense release within 2 hours of a long run and reported better energy and motivation on training days. If you have low testosterone or persistent energy loss, consult an endocrine colleague like Dr. Patel for a targeted evaluation. Now a concrete clinical example and a backstory to ground the data. Michael is 61, lives with his partner Priya, and came to me worried that daily release was making him feel tired and less interested in work. He described a pattern where he felt good immediately, but then experienced mid-afternoon fog and a drop in motivation. He had a borderline PSA and a history of a sedentary job. In our first appointment, I interviewed him, ordered labs, including testosterone and prolactin, and suggested a 7-day experiment while improving sleep hygiene. Michael's recovery included short walks after release, more water, and delaying release until after exercise on workout days. Over 4 weeks, he reported improved daytime energy and regained sensitivity. His case shows how small lifestyle tweaks combined with evaluation can change outcomes. Backstory of Michael in 2 short paragraphs. Michael grew up in a family where sexuality was a quiet topic. He retired from a manufacturing job at 59 and found himself with more idle time and a growing habit of using release to fall asleep. He was never medically complex, but carried anxiety about aging and his prostate. The combination of more free time, less structured days, and easy access to private stimulation created a rhythm that felt comforting but gradually eroded daytime energy. He felt ashamed to bring it up until the fatigue started affecting his walks with his dog and his conversations with his son Daniel. When he finally came in, he was surprised to hear that this pattern was common, fixable, and not a moral failing. We need to talk about tension points I see in clinic because these are the moments where men must decide to change or seek help. Tension moment 1, the first time he notices persistent pain or blood. The scene hangs heavy. You feel a new ache deep in the pelvis, a sharpness after release, or a drop of blood on the tissue. It's confusing and scary, and many men wait. In that moment, you weigh embarrassment against seeking help. In my clinic, I palpate the prostate, ask about urinary symptoms, and order simple tests. Early evaluation rules out infection or bleeding sources and prevents complications. Tension moment 2, when energy and motivation drop steadily. The man who used to wake and go now sits, watches screens, and loses drive. Friends like Carlos notice he is less engaged, and at work he misses choices. This slow erosion often pushes men into shame and avoidance, feeding a cycle. We assess sleep, testosterone, mood, and behavior patterns, and use stepwise interventions. Sleep first, then lifestyle, then labs, then targeted treatments. Tension moment 3, the relationship strain. Priya sits across the bed and says she misses intimacy that felt mutual and spontaneous. The man responds with defensiveness or withdrawal. The fear of disappointing a partner magnifies guilt, and the couple stops communicating. I bring partners into the conversation when appropriate, suggesting couple strategies to build variability, timing, and shared recovery rituals that restore sensitivity and closeness. Practical steps you can use right now. Try this 7-day experiment. Day 1, pick a baseline frequency you feel you can sustain and record your 5 daily markers each morning. Keep hydration above 2 liters if your body tolerates it, aim for 7 to 8 hours of sleep, and include 20 minutes of brisk walking after release to promote circulation. If you have a partner, agree on timing that feels restorative for both of you. If you notice pain, blood, sudden erectile changes, or a persistent loss of morning erections, stop the experiment and come in for evaluation. Use a simple bowl. If by day 7 you wake more restored on more than 3 mornings, your rhythm is likely supportive. If you feel more tired, reduce frequency and prioritize sleep and movement. For men on medications, with prior prostate surgery, or with uncontrolled diabetes, consult your clinician before the experiment. I want to return to the community invitation because it matters. If you ever found yourself wondering about daily release, you are not alone, and your experience helps others. Write in the comments now where you are watching from and a short note about how you feel afterward, in the format City Energized or City Tired. That short line is powerful. It helps other men see the range of responses, reduces shame, and guides future topics I should cover. Your responses will help build a community where questions about ejaculation, recovery, rhythm, hormones, and motivation are treated with curiosity rather than judgment. I read these comments, and sometimes I follow up with men like Daniel, who wrote from Lisbon and said he felt foggy after daily release. That comment led us to create a video on sleep and sexual timing. Thank you for sharing. Now, if you found this helpful, consider subscribing so you don't miss weekly, evidence-based guides on circulation, testosterone, recovery, and practical steps for men over 35. Final recap and medical note. You learned that daily release can have short-term benefits like mood relief and improved sleep for some, and potential downsides like temporary sensitivity loss, fatigue, mood dips, compulsive behavior, or masking of medical problems. The principle is rhythm, dose, intensity, and recovery. For the next 7 days, observe whether you wake restored or exhausted, track energy and sensitivity, hydrate, sleep well, and add gentle movement. If you notice pain, blood, sudden loss of function, or emotional compulsion that disrupts your life, seek a clinician for evaluation. This is not about shame. It is about data and self-observation. If this conversation gave you clarity, share it with a friend and subscribe for more grounded, practical guidance. My parting line is simple. Knowing your body's rhythm is the first step to reclaiming your energy and control.